Empowering consumers in choosing wisely and shared care at East Metropolitan Health Service. East Metropolitan Health Service provides a comprehensive range of surgical, emergency, mental health, ambulatory and primary health services to over 725,500 people living within Perth's Eastern Corridor. This includes provision of both hospital and community services within the East Metropolitan catchment area, in addition to statewide services such as the State Major Trauma Unit based at Royal Perth Hospital. East Metro comprises Armidale Kalamunda Group, Royal Perth Bentley Group, St John of God Midland Public Hospital and population health programs. In addition, East Metro is the tertiary referral hub for WA Country Health Service patients from the Kimberley, Pilbara, Eastern and Western Wheatbelt regions of WA and facilitates telehealth consultations for a number of outpatient services to regional and remote communities in WA. East Metro has 7 key service delivery principles to guide its performance, with a strong focus on establishing the service as a sustainable, forward-thinking organisation. One of the service delivery principles is the provision of consumer-centred care that empowers individuals to optimise their health and well-being. East Metro sets out to achieve this by encouraging consumers to be active in their healthcare journey and involving consumers as part of a shared decision-making process. As part of a campaign to educate consumers on what questions to ask at their next healthcare appointments, an intervention brochure was collaboratively developed with NPS Medicine Wise. The brochure is based on the 5 questions to ask your healthcare provider, adapted for the East Metro context. The aims of this study were to describe consumer attitudes towards their healthcare, and secondly, to measure the effectiveness of the intervention brochure. Over a 3-month period from July to April 2018, the intervention brochure was mailed out with appointment letters for patients attending outpatient clinics. A pre- and post-intervention survey was conducted to determine the effectiveness of the brochure. The sample size was 92 for the pre-survey and 102 patients for the post-survey. This included newly referred patients to a mix of surgical and medical outpatient clinics across Royal Perth Hospital and Armidale Health Service, whose appointment occurred during April to June 2018. The survey was a self-administered paper-based questionnaire. Questions were adapted from the NPS Medicine Wise template, and the pre- and post-surveys were similar except for a few questions specifically pertaining to the brochure. The administration clerk invited all patients within the sample to complete the form. Analysis was undertaken in SPSS version 25 with a chi-square or Pearson test applied to the pre- and post-survey data to determine statistical significance. The results were overall positive for the effectiveness of the brochure. The proportion of patients who agreed or strongly agreed that unnecessary medical tests may be harmful to the health increased significantly by 12%. There was also a significant increase of 32% in the proportion of participants who did not know what questions to ask their doctor. Although not significant, the proportion of patients who agreed or strongly agreed that some tests could produce misleading results that could lead to unnecessary treatment, and the proportion of patients who intended to ask their doctor questions both increased. Awareness of Choosing Wisely Australia also rose by 6%. Encouraging to have an active role in their healthcare journey as part of a consumer-centred approach to healthcare is a key service delivery principle for East Metro. Overall, this study found patients to have a positive attitude towards maintaining their own health and in telling their doctor any concerns that they may have about their health. The intervention brochure had a positive influence on increasing the health literacy of patients and their understanding to ask their doctor. Efforts are currently underway to provide the brochure to consumers attending outpatient clinics at all sites. Through targeted campaigns, awareness of choosing wisely is gradually increasing among consumers and contributing to a culture of shared decision-making.